My name is Rachel, and I work as a surgical technologist in the operating room. My duties are to set up and maintain a sterile field during surgery and to assist the surgeon if needed during the case. When I come in at 6:30, I start my day by checking the board at the charge nurse's desk to find out what room I'm scheduled in. Normally the cases start around 7:30, and I go to the room and I start preparing the room for the case by setting up my back table, my Mayo, which is where my instruments are held, and getting the room ready for the patient. Once the patient and the doctor are in the room and we have anesthesia and a circulator, which is a nurse, we begin the procedure. During the surgery, I assist the surgeon by holding retractors, passing instruments, loading suture, loading staplers, keeping a sterile field and protecting the patient. I help the surgeon as needed by using suction and Bovie. I work Monday through Friday from 6:30 to 3, and I take call as needed, usually 3 days a week, some weekends. It's a pretty high stress job, but very rewarding. The education requirements are you can get a diploma through a college, which from there you can get your certification, which is just taking a test, or you can get your AA. The skills needed: you need to be organized, you need to be able to see blood and not get squeamish. The best part of my job is that you never see the exact same case twice. Every patient's different, which makes it pretty challenging, so that makes it a lot of fun. The worst part is if you lose a patient. If they expire on your table, that's the worst part of this job. My final advice, if you're interested in becoming a surgical technologist in the operating room, is to take as much science and math as you can and research the field as much as you can. If possible, it would be beneficial to you to shadow someone in this position so that you can find out if you can stand what happens in an OR.